my name is Abby Niesen, and I'm a PhD candidate in biomedical engineering at the University of California, Davis. For my research, I'm studying how we can optimize patient outcomes after knee replacement surgery. Knee replacement is a treatment for late-stage osteoarthritis, which is a joint disease where the articular cartilage wears away, leading the bones to grind on each other, and this can be really painful. Knee replacement involves removing the diseased joint and replacing it with artificial implants. About 1 million people in the US undergo this surgery every year, and yet still about 1 in 4 still have pain and are not satisfied after the surgery. So this tells me that we need to rethink how we're approaching knee replacement. I collaborate with orthopedic surgeons who use an alternative approach to knee replacement. And the idea is to make it more personalized. The philosophy is quite simple. We should be removing the same amount of bone plus the cartilage that has worn away as the thickness of the implant that's going to replace it. In doing so, we can preserve the joint anatomy and the soft tissue surrounding it. One of the concerns with this personalized approach to knee replacement is that it places the implant that goes on the shin bone at an angle. And it's not really clear as to what degree of angulation could potentially compromise the interface between the implant and the shin bone. So I study this interface directly. I'm working with 70 patients who have undergone knee replacement with this personalized approach. And during the surgery, we place markers into their shin bone as reference points. Then after the surgery, I work with X-ray technicians to acquire images of the patient's knees. We acquire a front view of the knee and a side view of the knee. And then I can take these images back to my lab and basically use principles of projective geometry to recreate a 3D model of their knee. So by doing this starting at the day of surgery and then over time, so we're currently following these patients for 2 years, I can directly measure what is happening for each patient in their knee. And so far we have seen that on average, the movement is very, very minimal. It's about 1/3 of a millimeter. And this is indicative of healthy bone remodeling, which would occur after surgery. We also were looking at the movement of each individual patient relative to the angle of the implant on their shin bone. And what we've found here is that there was no relationship at all. So the angulation didn't affect the magnitude of movement of the implant. The findings of my research have the ability to encourage orthopedic surgeons to adopt more personalized approaches to knee replacement. I really hope that this helps improve patient outcomes in the future.